Welcome to the Nonprofit Report, your update on nonprofit organizations, issues, and leaders. I'm your host, Mark Oppenheimer, and today I have just the utter delight of bringing to you leaders from the National Council for Mental Wellbeing, as May is Mental Health Awareness Month. And I'd like to welcome our guest, Chuck Ingoglia, President and CEO of the National Council for Mental Wellbeing, and a nonprofit that provides a unifying voice for organizations delivering mental health and substance use recovery services in America. And Brandy Vandermark-Murray. Brandy is president of Horizon Health Services, which is a mental health and substance use organization. She's also a counselor, also chair of the National Council Substance Use Committee. Brandy, it's great to see you, and I am going to exploit your expertise today because this is such an important issue, and mental health, substance use, all these different aspects are just now in this era being treated as conditions, as not personality weaknesses, but real physical medical conditions. So let's talk about the fact that April was abuse awareness month. May is mental health awareness month. There are over 30 million Americans who lack access to affordable, comprehensive mental health and substance use. So, Chuck, what is the concept? If I have a broken arm, right? I go into my doctor, I get treated, nobody's going to ask. I don't have to jump through any hoops. What is the consequence of lack of affordable care for my mental health versus my broken arm? Because if I break an arm, I get time off from work, I get medical attention. What's that consequence?
Yeah, well, I think, Mark, to your point, there's a growing body of evidence, right, that all these illnesses, mental illnesses and substance use disorders are real, common, and treatable, that they're just like physical health conditions. And I would just say in the years that I've been in the field, I'll just mumble how many that's been. I think there's been a great evolution of people recognizing the importance of getting treatment for mental illness and substance use. We've got a way to go. But to your point, right, if you have a broken arm and you don't get it set, your arm's not going to work right. If you're living with depression or anxiety or substance use disorder and you don't take care of that, well, that has effects on you, right? You're not as engaged as you want to be with your family or at work, or you might lose your job, or you have other consequences. And we see so much of that happen in our society, right? Where people don't pay attention to these things and they end up having problems. The great news is that there is treatment available, and most people who get treatment get better. And that's the good news, right, Brandy?
Absolutely. And Chuck, when you mentioned families, I think about, you used the analogy about a broken arm. While you might be in pain and you might have some physical limitations, mental health disorders and substance use disorders, we know, impact the family system significantly. And they're both progressive diseases often. So untreated, the symptoms get worse and worse and worse. And so when we look at the impact it has, it's not just the impact on the individual, it's an impact on society. And that's really where the real costs come into play that we wanted people to pay attention to. It's not an other issue, it's an our issue. We need to take care of it.
And I would just say one last thing, right? The head is connected to the body. And so when we don't pay attention to mental health or substance use conditions, it has effects on our physical health as well. Mm-hmm. People who are depressed and have diabetes don't necessarily take care of themselves, or other illnesses, right? So that's also the reason why we need to be paying attention to these things.
The thing that strikes me about mental health and substance use disorder in particular, that is distinctive from physical ailments like a broken arm, is that very often the thing that works for a while becomes the source of the problem when overused. You can decide that you're going to self-medicate for a little while, and you can do it by eating, by gambling, by drinking, by smoking weed or whatever it is, right? You're self-medicating. maybe that works for a little while, but you keep doing it, you keep doing it, you keep doing it. Eventually, it becomes an addictive behavior. You're gambling, you're over exercising, you're overeating, whatever it happens to be, right? How do you, Brandy, when you're interacting with somebody and you're talking with somebody where they've used this coping mechanism, but the coping mechanism starts to cause harm, how does that actually inform how you interact with families and patients, where you're trying to say, okay, might have worked for a bit, doesn't work now?
Well, I think when you frame it as a maladaptive coping skill, it also takes away the shame and the guilt around it, right? It was serving you a purpose at some point, and that purpose might have been protecting you from something, whether that was, trauma, or that was your depression, or whatever it may be. And so I start a lot of times with educating people that it's a brain disease. So take away this element of you just made poor choices, or this was about something you did.
Weak character, right?
Yeah. But science is helpful for people to understand, because then they realize we're going to help you develop healthier coping skills. And it's going to be scary, right? Because we're going to take some of those negative coping skills away, but your brain needs time to heal. And so how do we do that? So it's normalizing that all of us have maladaptive coping skills, and some of us, unfortunately, are on the path of addiction, and some of us aren't. And so we don't always know who that's going to impact. And so let's figure out the best coping skills for you, whether that's healthy supports or harm reduction or reduction of use or really medication, whatever it may be. But education and normalization that this isn't a choice, this is something we have to work on, changing a behavior, is usually how we start. And it takes time. It takes time for people to heal.
Chuck, look at how I'm sitting, right? You see how I'm hunching over and so on? So I get some pain, right, in this area. Isn't that part of what's going on, right? Physical therapy is used to and it's become very routine, used to deal with these kinds of things. And certainly as we get older, physical therapy becomes part of our lives. Do we need to take a view that this approach needs to also deal with emotional journeys, right? If we overuse an emotion and we become addicted to a set of hormones that go through, and maybe we're addicted to depression, or maybe we're addicted to certain behaviors, right? Aren't we built for a certain type of addiction that needs to be queried? And
well, I mean, I think, Mark, what the way you just described that also makes me think that I think people have this idea that, if I get in therapy, I'm going to be there for the rest of my life, right? And I think it's about, like, you're not in physical therapy for the rest of your life, right? You're in physical therapy to ameliorate whatever is causing you.
But I might need to work out periodically for the rest of my life, right?
Absolutely. But I think it is okay that some of us just need a tune-up, right? This notion of solution focused, like, therapy or short, that is great. Some people might need it for a long time, right? Because their condition is more complicated or it has more consequences, but not every course of treatment is going to be exactly the same. Just like when you have high blood pressure, we don't all get treated exactly the same way, right? Our physician takes account of, what's happening in our lives, how much our numbers are changing. And then, we have a shared decision-making model, right? Of, hey, I think you should take this medicine. And, the same thing in mental health and substance use care. There's not one size that fits all. And, sometimes it's going to be short term, sometimes it's going to be longer term, but that's all related to the reality of what's happening with that person and in that interaction with their healthcare professional.
Well, I also think about, you said physical therapy, and I thought you were going to go in a different direction, Mark, around everyday coping skills help us with mental wellness, right? There's mental wellness and there's mental illness. And so a lot of times people will say, oh, I'm too old to go into therapy, or, I never had this problem before. And I think about, we have this continuum of mental health. And if you are someone who has lost someone suddenly, right, you might need to go in and get support despite having some good tools. Or you might have different stages of your life, right? So when I look at who comes in the doors, our fastest growing population coming in for both mental health and substance use are people ages 55 and older. And so part of that is because they're going through different stages of their life. whether that could be different relationships, coming on retirement, health issues that are now impacting their mental health. And so, mental wellness is our responsibility throughout our whole continuum. And it's not just about illness.
The other thing that strikes me is that people who have the ability to manage themselves and treat themselves, people who have a little bit more means, as in physical ailments, are not obviously so afflicted. Whereas people who are poor, right, who don't have a need, that accumulates, right? So mental health treatment, accessing the treatments that your organization provides, Brandy, and that the people you represent, Chuck, provide, that's all tied to wealth. And so poor people have so many different accumulated issues, not because those poor people are different, but because those poor people can't access services as easily.
That's a really complicated thing you just talked about, right? Because the reality is mental health and substance use conditions strike everyone, regardless of their income, physical characteristic, ethnicity, age, right? That they're equal opportunity illnesses. I think what you're getting at is also the complicated it's biopsychosocial, right? And there's all these different things that come into play, and also how mental illnesses can interfere with keeping a job or keeping a family. And the way our systems are set up, right? You most likely get your health insurance from your job. So if you can't keep a job, that has a compounding effect. And if you're lucky enough to get on disability, you can't have assets that more than $2,000, right? And there's like all these different things that come into play that can sometimes make the journey more difficult. But I wouldn't say it's just about the mental illness or the substance use. Brandy, would you say something different?
No, I think I think of upstream drivers, things that impact our wellness. If you don't have stable housing, you, of course, are going to have more anxiety. You're going to have more physical elements as well. If you don't have appropriate nutrition, you're not going to feel well. You're going to miss work. You're going to perhaps have depression. They're all interconnected. So the work that many of us do is really try to provide wraparound services to treat people. And that is from spiritual health to stable housing, to making sure they have access to food, to education, to a sense of purpose, because that's what makes us well. All those things combined, not just one and done. But your point about access is that sometimes the resources we have that make people well are concentrated to communities who have the means. And so how do we make sure we have a little bit more dispersity across those boards? Because Chuck's point, mental health and substance use impact every sector, including probably our own families. And I think it's important to say that out loud to continue to challenge the stigma that is existing still.
And part of the point was that the people you represent, Chuck, at the National Council, you're talking about a lot of different services.
Yeah.
You're talking about a lot of different clients of those organizations. You're talking about a lot of different needs. So talk about that means that you cannot look at the organizations that are part of the National Council as kind of generic organizations, right? It's very geographically very specific. It's very urban versus rural versus suburban specific. It's very income specific. It's particular services. That's a huge range of support, right? And it's not quite as developed, the ecosystem, right? We have, in the physical side, we have organizations that support cancer and ALS and cardio and all these different subgroups, right? But in mental health, it isn't as developed, but you have a huge range of different constituents. Talk a little bit about that range and how you try to meet those different needs as one organization.
Yeah, Mark, you just talked about one of the most fun and challenging parts of my association, right? Is that we do have members in all 50 states, as small as a few $100,000 in budget to we have $1 billion in budget, right? And so there's a huge variation. And I think one of the great things for most of our members is they serve anybody who walks in the door. And I think one of the challenges is you serve everybody who walks through the door, right? And how do you think about the right interventions and
We have
workflow?
3,200 members.
Yeah.
I mean,
Yeah,
that's
I have 3,200 members, and you just think about Brandy's in near Buffalo, and the difference between Buffalo and New York City and Saratoga. I mean, just like already, you can just imagine the variation that you have just in New York State, let alone New York State versus Wyoming or versus Montana. And this is a challenge. We don't really have a healthcare system in this country, right? We have a collection of services, and that's also true, for mental health and substance use. But we keep working at it. We have ideas that we're pursuing through federal legislation with state legislatures to try to create more of a consistent experience for people, no matter where they are. Trying to create more consistency in how those services are reimbursed, and it's the great challenge. It's why I'll have a job for many years, and we keep working at this to try to make improvements.
Well, and while you say it's a challenge and there's a ton of diversity, every time you come to the National Council, you learn something from other members of the association, but we actually have more in common than we have in differences. And I say that because, we are person-centered, and I say we, and that's across the nation. When we're treating individuals, we come from that approach. And we are all really fighting for equitable access, right? We want people to have access to services. And so while we might approach things differently, and maybe our funding streams are different, and maybe, we're using more technology in one area than others, there's those differences. But there's a lot of pillars that are very similar that let us work collaboratively together.
So when you set your agenda, Chuck, I mean, you don't have an infinite amount of resource to invest in everything that everybody wants.
Well, maybe your listeners could help with that, but yeah.
Excuse me?
Maybe your listeners could help.
Well, resources are really important, and that's right. No kidding, right? If you have more, you can do more, and you can wisely spend money on things that are absolutely necessary. But go with me a little bit, because I'm going to ask you, if you have to make decisions amongst things that you can spend money on and resources that you can assign and areas that you don't, what are your top priorities? And how do you reach those priorities so that your members can support that prioritization, even if it's not everything that they want?
Yeah, to Brandy's point, I think our members have more in common than not. And, especially the members of the National Council are predominantly serving low-income folks, so Medicaid recipients or uninsured. And so when we think about the work that we're going to do, both from a policy perspective as well as a practice improvement, we try to focus on the things that are going to hit the vast majority of our members, right? So when we're setting our policy agenda...
Yeah.
Impact, right?
Yeah, impact, right? So our policy agenda is going to be, we're really going to focus on Medicaid. We're really going to focus on the programs at the federal level that support folks who are uninsured. The basic ideas, right? How do we protect or grow resources that enable our members to be most effective in their communities? And while there's going to be variation, we try to really focus on the things that are going to have the most impact.
And impact based on impact on society, impact on cities, impact on states, impact on rural areas, right? I mean, what you're basically doing is trying to deal with something that can erode the quality of life in real and material ways for families, for individuals, for communities, right? And you're having a dialogue in terms of how those resources should be spent in order to have a stronger community. Brandy, when you're interacting with people, what concerns do you hear out there about our state of affairs today?
Most recently, even as of this morning, I think people are concerned that healthcare will become less affordable. And so, we have done a really good job in the past few years expanding access with CCBHCs and other initiatives. But people are concerned that they won't be able to afford it for various reasons, whether it's a health insurance reason, whether it's just affordable co-pays, if you're not a Medicaid recipient. That is what I'm hearing a lot of. And then from a clinical perspective, really just how much it's impacting children. And so we're doing a lot of preventative education, I think, in the field, which is great, right? If you can stop the crisis before. But people consistently are kind of calling for young adults, children. We serve individuals 3 and up. And I talked about older adults, but individuals under 12 are also fast growing. So those are the things I'm hearing, is the impact on children, and then the affordability of, like, is it going to get worse before it gets better? And quite frankly, it can't get worse because we're making progress. And so we have to kind of keep moving and advocating for people to have access and affordable access.
Isn't there an aspect as well of self-healing? Because if you've experienced trauma, you're probably best positioned to support others to navigate that terrain itself. So it goes from being debilitating personally to changing your own attitude and sharing your experience with somebody else who might be going through what you've gone through in the past. So this is really about empowering communities, using your own strengths, your own experiences, empowering individuals to become the healers that they wish they had perhaps in an earlier stage of their lives. And so I was very interested to see all the workforce development programs you have, all the public health and integrated health programs you have. You're also training people from adjacent disciplines in mental health awareness, in substance use disorder diagnosis and awareness and treatment, how to dialogue with each other. What other particular programs do your members, Chuck, put forward as models that we could all learn from?
Well, I would say 2 things. One, I just want to pick up on what you're saying about mental health first aid. It's a program that we've been operating here in the United States for about 15 years, and it's really simple and really genius, right? Which is, if you have the right language to understand what's happening to someone, you can intervene and help them get to treatment. And for so many of us, we just don't have the words, right? We see that something's wrong with someone, but we don't really know what's happening or why that's happening. And we therefore don't feel comfortable. So having that language. I think the other thing that your question made me think of is one of the great evolutions in our field has been the involvement of people with lived experience, both people who've recovered from substance use conditions or people living with mental health conditions, and having them part of the engagement and treatment teams to support people. So I think those are 2 things, but we can't forget also that we need to have, that there's also a really important role for licensed and trained folks. And that's where we're spending a lot of time making sure that people actually can get through that process. So, one of my favorite projects that we're doing right now, I kind of call our low-hanging fruit project, is people who graduate with a terminal degree that would enable them to practice, and making sure they actually get to licensure and end up in the field, and supporting them through that process. So there's like so many barriers that could prevent people who want to do good from being able to do it. So everything we can do to help them along is kind of our philosophy.
Brandy, I have a question for you about this whole idea of integrating mental health into pretty much our daily lives. We live while we have other conditions, living with an illness like a cancer, or living with a disability like blindness, or helping a family member deal with intellectual and developmental disabilities, or dealing with a person who is aging and might be facing retirement and not know what to do, or might be facing financial stress. When you're thinking about all of us, you, me, Chuck, and everybody else out there, aren't we in many respects dealing with, just because we're living, mental health challenges every day? And if we think about it in that way, then we're all receiving some sort of a treatment. Maybe it's from friends. Maybe it's from somebody with a PhD, Chuck. Maybe it's somebody who is a certified counselor. But isn't that sort of the way of life? And therefore, as we look around each other, we're looking at a society. It's not that we're paralyzed by the need for treatment. It's just that it's part of living. It's like oxygen, isn't it, Brandy?
Well, I think when you say we all have mental, health challenges, we all absolutely have challenges. I think that we have individuals who don't necessarily have the best coping skills, or sometimes have a disease, have a brain chemistry disease. And so they're not going to be able to without therapy or without medications and all of those things. And so we know, about 20% of Americans have a mental health disorder and 100% have mental health challenges, right?
There
and
we
so
go.
we have to kind of figure out, the difference. And I think that we help each other where we can develop coping skills as much as we can. But that 20% might need more. And that's okay. And I think we have to say that out loud. That's okay.
And we have to, as a society, agree that it is okay for us to spend money. For me, who might have no disorder but challenges, for me to help those who have a disorder.
We all are on the fringe, right? Something can happen to us that puts us into that 20%, and be grateful that perhaps you're not there. But stuff happens. We looked at COVID. We look at anything traumatic. I mean, those experiences, you may need that support, and you want that support and treatment to be there when you need it, if you should ever need it for you or your loved one.
You've given me a great tool, right, Chuck? This idea of challenge versus disorder. You've given me a great tool for thinking about the continuum of need within the society. Chuck, you want to have any final word on how we ought to be thinking about mental health and how we should support the National Council and National Council members going forward? Any words of wisdom?
Well, I think Brandy said it right. That there's all of us live with this balance between mental health and mental wellness, right? And we're all on a continuum, and just being aware of that, being willing to ask for help when you think you need it, and know that there are resources available in your community. There are organizations everywhere. There's a provider finder on our website. SAMHSA has one too. Take advantage of those things. Lots of online resources. And certainly, if you really want to know more, sign up for a mental health first aid class in your community and learn how to learn a little bit more, and learn how to be a support to your friends and family.
Brandy, if you were going to boil it down to one thing, what is the most important need that this organization and these members in the mental health and substance use field require from us?
I think acknowledging we need stable funding streams. So, working for a not-for-profit, large not-for-profit, you have various funders. The unpredictability, though, sometimes makes it difficult for us to move forward with advancing evidence-based practices or retaining our workforce. Chuck talked about bringing people in the workforce. I ultimately want to keep really skilled people to help people get better. And that requires resources and funding, investments in the healthcare system.
And Chuck, what if you had more resources, how would those be deployed?
Well, I think to Brandy's point, our members are only able to serve the amount of people that they have funding for. And we're entering a period right now with the implementation of HR1, the One Big Beautiful Bill, that is going to take resources away. And so we need people to really understand what's happening, to be involved politically, to be involved in their community, to advocate for sufficient resources. States are going to have to make some really difficult decisions, and we need all citizens engaged with their legislature to help them understand the impact of these decisions.
And it will imperceptibly affect economic activity. It will imperceptibly affect families. It'll imperceptibly affect communities. It'll imperceptibly affect our whole civil society. It's not as if you're going to have a light switch where the withdrawal of funding is going to instantaneously be visible, but we will feel it every single day going forward into the future.
I think that's one of the interesting things about mental health and substance use conditions is that if they're treated, it has positive impacts in multiple places and for people individually, but for systems as well, right? Less people fewer people using emergency rooms, fewer people homeless, fewer people engaging the criminal justice system. That there are ripple effects. And also, if you get your mental health and substance use treated, that your physical health conditions get better too. Mm-hmm. So there's physical health spending that goes down. And so it's hard sometimes, I think, for policymakers to understand the ripple effect of why it's so important to have treatment.
Wonderful. Yeah. Wonderful. Thank you so much. Chuck Ingoglia, President and CEO of the National Council for Mental Wellbeing, and Brandy Vandermark-Murray, President of Horizon Health Services, and also Chair of the National Council Substance Use Committee. Thank you so much for sharing this insight with us. Please thank your members. Please thank your funders. Please thank your staffs. Really wonderful to have you on, and we so appreciate your wisdom.
Thank you.